Let's bring in now Dr. Ahmad Yousaf, who joins us live, a paediatrician who volunteered at one of Gaza's only remaining hospitals. Dr. Yousaf, first of all, thank you so much for talking to us here on TRT World. Can I start by asking you, which hospital did you volunteer at? And could anything have prepared you for what you were confronted with there, emotionally, mentally, or even from a medical skills point of view?
Thank you so much for having me. I was stationed at the Al-Aqsa Shuhada Hospital in Deir Bala. Your prior guest noted that area was considered the green zone at that time, an area that was deemed safe by the IDF. Since then, there's been many bombs exploding in that area. The truth is, the time that I spent there, I've been back about 2.5 weeks and still really haven't processed what I saw because nothing from a training perspective, either psychologically, physically, and most definitely medically, could have prepared me for how hopeless and helpless the situation truly is. The Gazan people are experiencing in a level of carnage and devastation that I couldn't possibly have anticipated, despite all of the, social media kind of videos we've seen over the last 9 months. It was shocking.
And you have experience of working in one of these few hospitals that is indeed still functioning there. What is the state of the hospitals? What sort of medical supplies do you have? And is anything getting in anymore?
I can tell you from personal experience that nothing was getting in during the time I was there. The hospitals are working with limited supplies. Every day was a day where we had to choose who got what limited supply or what makeshift kind of MacGyvering of medicine, where we had to use this medicine for a non-ideal situation, or no medicine at all. Our gauze was basic for wound care. We're using betadine to sterilize supplies that should have had autoclaves or more serious sterilization techniques. There were many days where I didn't have gloves. I'd rip through gloves and realize there weren't any left, and we'd have to use our bare hands from patient to patient, which wasn't ideal. When I went, I had 7, 8 bags, 6, 7 bags prepared for medical supplies that I had taken as donations that I've done similarly on many other medical missions, and those were completely denied at the border. The IDF did not allow anything in regards to medical supplies. In my personal experience, that was not hearsay. That's my own personal experience. We were limited completely. The number of doctors who had supplies left in Amman, Jordan, or other places at the border were many, and that was a consistent theme for us.
And let's talk about these repeated attacks, direct or directly targeted attacks on crowded refugee camps and UN schools where people are seeking shelter. They're meant to be protected under international law, aren't they?
Look, there's no other word that I can use as a layperson. I'm not a politician. I'm not a military strategist. I'm a humanitarian aid worker and a physician. What I saw when I was there, uh, the vast majority of the patients I treated were children. The vast majority of the people dying in and around the green zone were children and civilians who showed no signs of any type of military engagement. There were no weapons or gear. There was just people in pieces. And that was an everyday experience while I was there. And I don't, I try not to use the words that are inflammatory when talking about this as an aid worker, but my lying eyes saw directly the most vulnerable people in that environment being the most affected every day.
And Dr. Yousaf, if you don't mind me asking a personal question, how did you feel leaving behind so much suffering, so much destruction, and do you think you'll go back?
The question's a heavy one because every aid worker there, international aid worker there, American, Australian, from the UK, from France, all felt the same thing that I felt, and I felt every day since I've left, which is an immense amount of shame that we've allowed as a society and a world in 2024, uh, this group of people to be so vulnerable and so unprotected in the onslaught against them. And then the immense amount of guilt that we get to leave back to our families and to our loved ones, that we get to say that our children are safe tonight in our beds here in the States without any risk of bombs dropping on them. And unfortunately, the Gazan people will have to face that until the world recognizes that a ceasefire has to come and this has to stop.
Dr. Yousaf, we really, really appreciate your time. Thank you so much for speaking to us and sharing your experiences with us here at TRT World.